Hello, students. This is Dr. Reena Randhir. Welcome to Chapter 8 on the Appendicular Skeleton. So, the student learning objectives for this lecture for us to go over the bones of the appendicular skeleton. Appendicular, the word comes from appendages, that means to add on. So, we studied the axial skeleton last week. So, in the appendicular skeleton, we'll be talking about the pectoral girdle, which would be your shoulder girdle, your pelvic girdle, and we'll see how the limbs are attached to the axial skeleton. We'll talk about the bones that make your upper limbs and the lower limbs, the main bone markings that are responsible for muscle attachment, for attachment of tendons and ligaments. We'll also talk about the main difference in the male and the female pelvic cavity here. So, what is the appendicular skeleton made of? So, the skeletal system is made up of 206 bones. Out of this 206, 126 come from the appendicular skeleton. Your shoulder girdle or your pectoral girdle is made up of clavicle. We have two clavicles, which is the collarbone, and two scapula, which is the shoulder blade, coming together to make the pectoral girdle or your shoulder girdle. Your upper limb is made up of your arm, your forearm, and your hand. So the upper arm is the humerus, radius in your forearm, and ulna. Radius is lateral, ulna is medial in the anatomical position. We have 8 carpal bones in each hand, 16 in total. Palms are 10 metacarpal bones and 28 phalanges in total. Coming to the pelvic girdle that attaches your lower limbs, we have the coxal bone or the hip bone, your thigh or your femur for your lower limbs, patella that makes your kneecap, tibia and fibula that form your leg, tarsal bone that make your ankle. We have 14 of them. We have 10 metatarsal bones and phalanges, which would be your toes, 28 of them. So we have 64 bones in the upper limbs and 62 in the lower limbs. And the girdles will help to attach the limbs to the axial skeleton. So the arms and legs, they bring about movement in our body. So it allows us to move and manipulate objects. We use our hands and feet all the time. So this is a picture of the pectoral girdle or your shoulder girdle. You can see how the pectoral girdle connects your arms to your body. It is very important for your posture. It positions your shoulder and it provides a base for your arm attachment. It is made up of clavicle. So we have 2 clavicle or collarbone, clavicle, and 2 scapula, scapulae for plural. So the pectoral girdle is the connection point that will connect your limbs, your upper limbs, to the sternum, the manubrium part of your sternum. So here is a picture of the clavicle. So there is a lateral view, a superior and an inferior view. The clavicle is also called as your collarbone. You can palpate your clavicle. So there are three main parts. So it is a long bone, the only long bone in your body that sits horizontally in your body. It has three parts: the medial end that articulates with your sternum, so we call it the sternal end. It has a shaft, and then it has the acromial end, which will articulate with the scapula. So at the sternal end, it is articulating with the manubrium of the sternum. It will form the sternoclavicular joint here. And this is the only point of attachment between the pectoral girdle and the axial skeleton. And because of this, it offers a wide range of motion. The lateral end is also called as the acromial end, and it will articulate with the acromion process of the scapula, making the acromioclavicular joint. So, lots of muscles will originate from the shaft part. So, the shaft will act as a point of attachment for several muscles. There are two main bone markings. There is a conoid tubercle, where the conoid ligament will attach to the clavicle. And there's also a costal tuberosity, where the costoclavicular ligament that will attach the clavicle to the costal cartilages of your ribs, your first rib. Here's a scapula, or your shoulder blades. So here's a picture of your right scapula, your anterior view and your posterior view. You can see how the scapula, the spine of the scapula is posterior. Another interesting feature is they are not attached. That's why we have a free range of motion in your ball and socket shoulder joint. So it is a flat, irregular shaped triangle bone. It is also called shoulder blades. They are going to articulate with the collarbone, your clavicle, and also to the head of the humerus here. There are three main sides. So we call it the medial border, that is adjacent to the vertebra. So it's also the vertebral border, the lateral border, and the superior border. Because there are three sides, there's also three angles: superior, lateral, and inferior angle. In the anterior surface, it will have a subscapular fossa also. And posteriorly, you can see a spine. It's called as the scapular spine. It is like a ridge. It's protruding out. And then there are two main processes from here. And the fossa above it is the supraspinous fossa. The fossa below the spine is the infraspinous fossa. So here in the lateral view, you can see the main processes. So you can see there is a cavity called glenoid cavity. So this is where the head of the humerus is going to articulate, forming the glenohumeral joint. There is a process that looks like a bird's beak. It's like a raven's beak. It's called coracoid process. It is anterior, smaller compared to the acromion, which is the highest point, that will articulate with the clavicle via the acromioclavicular joint. So the scapula has a lot of very important processes and bone markings that will play a huge role in muscle attachment and forming these joints. Moving on to your upper limbs. So if you take your limbs, your arm, it is there are three main parts. So the upper arm, the humerus, is the bone is called humerus. The arm is the radius and ulna. The carpal bones make your wrist. The metacarpal bones will make your palm of your hand, and your fingers are your phalanges. So it consists of the arms, the forearms, the wrist, and the hands. The humerus or your arm is also called as the brachium. It is a long bone that makes your upper arm, and it's going to articulate with the pectoral girdle through the glenohumeral joint. So close up, you can see some prominent bone markings. So this is the proximal epiphysis region, this is the shaft, and this is the distal epiphysis region. In the proximal epiphysis region, you can see there is the greater tubercle and the lesser tubercle, and then it is separated by this groove or a sulci, which is called as an intertubercular groove. So this is where the tendon of the long head of the bicep will run in this groove here. So this will attach the head of the humerus to the glenoid cavity. The greater tubercle is lateral. It forms your shoulder tip. The lesser tubercle is anterior, and it's also medial. The head is rounded, and this is it will have a cartilage to form the ball and socket joint of your shoulders. It has, so this is called as the head, and then right underneath, below it, is the anatomical neck. So this is the margin of the joint capsule. And then it is the surgical neck. It's called surgical neck because this is the most common place for a bone fracture to happen, and surgeries are made here. So this is the narrow part of the metaphyseal region here. So in the shaft region, there is a rough patch. It is called as the deltoid tuberosity. And this is the attachment point for your deltoid muscle. Posteriorly, you'll see a radial groove for the radial nerve. So some of the main important bone markings distally in the distal epiphysis would that it have a lateral, a medial, and lateral epicondyles that will play a role in muscle attachment. The condyles of the humerus will articulate with the ulna and the radius of your forearm here. So the articulations are going to happen here. So the main articular regions that you can see in the condyles are the trochlea. See, this is the process, the projection that you're seeing here. The olecranon fossa that is seen in the posterior aspect, and the coronoid fossa. The capitulum radial fossa will articulate with the radius. So there's another picture here, close-up picture. So you can see the trochlea, the coronoid fossa, and the olecranon fossa. And you can see the capitulum and the radial fossa. So these are the articulation points that to form your elbow joint. So moving on to the forearm, it is also called antebrachium. The two bones are held together with intraosseous membrane. So the two bones are held together. So in anatomical position, the ulna is medial and radius is lateral. So there are two long bones held together by intraosseous membrane. The radius is lateral and ulna is medial. The radius will line up with your thumb in anatomical position. So the radius is the thicker of the two bones. So here's the ulna. See, in the ulna, some of the main things about the ulna, the olecranon is the superior end of the ulna that makes the point of your elbow. The olecranon. So here's a close-up. You can see the olecranon process. And then there is a trochlear notch, this U-shaped notch, a coronoid process, a radial notch, ulnar tuberosity. So these are all vital for all the articulations that happen with the ulna. So the superior lip is the trochlear notch. The coronoid process is the inferior lip of the trochlear notch. It articulates with the humerus. So when the forearm is extended, the olecranon will enter the olecranon fossa. And when the forearm is flexed, the coronoid process will enter the coronoid fossa. The radial notch will articulate with the head of the radius, and it forms the proximal radio-ulnar joint here, proximal radio-ulnar joint. And in the distal part, you can see a styloid process. Here's the styloid process that will attaches to the articular disc of your wrist, and it will stabilize the carpal bones here. So moving on to the radius. Radius, as I told you, is lateral. It's the lateral bone of the forearm. A good way to recognize it is it'll have a radial head. It'll look like a bottle cap here. So that's the radial head, followed by the neck of the radius. There's a radial tuberosity, and here's the shaft of the radius, held together by intraosseous membrane, and distally you can see a styloid process of the radius. The radial tuberosity, right under the head, is the point of attachment for the biceps muscle. So it articulates proximally at the elbow with the capitulum of the humerus and the radial notch of the ulna. Distally, it articulates with the ulna at the ulnar notch, and it also will articulate with your carpal bones. So styloid process is the pokey projection distally. So this will stabilize. It will dip into the carpal bones and it will stabilize the carpal bones. So the fibrous sheet that keeps the two bones together, it's called as the intraosseous membrane. So you can see that the radius is the lateral bone. And some of the main bone markings are listed here. Coming to the bones of your wrist and your hand. So there are 4 proximal carpal bones and 4 distal carpal bones. So the scaphoid is near the styloid process. The lunate is medial to the scaphoid. There's one that's called trachetrum, and then there's pisiform, and there are 4 distal carpal bones. Your palms are called metacarpal bones. So your thumb, that leads to the thumb, is labeled number 1. The pointy finger is 2, 3 for your middle finger, 4 and 5. So they're just numbered. They articulate with the fingers or the phalangeal bones. Your thumb has 2 phalanges, the proximal and distal. Whereas all the other fingers will have 3 phalanges, the proximal, the medial, and the distal phalanges. So these are the bones that make your wrist and your hand. Carpal bones, metacarpal bones, and phalanges. Moving on to the pelvic girdle, these are weight bearing bones. They are bulky and they are strong. It is made up of two coxal bones. So it's shown in purple and pink and yellow here. There are two coxal bones that make the pelvic girdle. They are very strong because they have to bear the weight of the body. And they are also going to be the attachment point for your legs. So they have to also bear the stress that comes with bringing about movement in your body. So if you take the coxa, it is actually three bones that are fused together. The purple is the ilium, the yellow is the ischium, and the pubis. And they are held together by the pubic symphysis fibrocartilage. So when you say pelvic girdle, it's only the two coxal bones. But when you say pelvis, it is the two coxal bones and its articulation with the sacrum and the coccyx, which is stabilized by a lot of ligaments of the pelvic girdle, sacrum, and the lumbar vertebrae. So we look at the major bone markings of the coxa. So if you take the coxal bone, so it's made up of the ilium, ischium, and the pubis. There is a prominent cup like structure that is going to articulate with the head of the humerus. It's called acetabulum. In Greek, it comes from the Greek word acetabulum. It looks like a vinegar cup that they used in those days. This is the junction of the three bones, the ilium, ischium, and the pubis, and it is found on the lateral surface of the coxal bone. And the head of the femur is going to articulate here. So some of the main bone markings you can see. So the topmost edge is called as the iliac crest. So when you put your hands on your hips, you're actually putting your hands, resting your hands on the iliac crest. And then it has a whole range of spines: posterior, superior iliac spine, posterior, inferior iliac spine, anterior iliac spine. So there's a whole bunch of ischial spine. And you can see two main prominent notches: this great sciatic notch, through which the sciatic nerve will pass through, the lesser sciatic notch. You can see a huge foramen. It's called the obturator foramen. In the medial view, you can see a line called arcuate line. And there is a depression here called iliac fossa, which is the depression between the iliac crest and the arcuate line. So you can see the ischial spine here, which is above the lesser sciatic notch, ischial tuberosities, which is posterior. And this is the part where you sit on. So when you're sitting, right, you're actually sitting on the ischial tuberosity. It is the posterior projection. And this is the pubic tubercle. So this is where you'll find the pubic symphysis, which is the anterior gap between the two coxal bones, and you'll see a pad of fibrocartilage here. Interesting point to note here is that will soften during childbirth in women to for delivery, the fibrocartilage. The huge foramen is the obturator foramen. It is formed by the ischial and the pubic rami and attaches to your hip muscles. Several arteries and veins and nerves will pass out of the pelvis through this foramen. The articulation between the ilium and the sacrum is called as the sacroiliac joint. And that will be stabilized by a series of ligaments. So moving on to the major differences between the pelvis of the male and the female. So here, the female pelvis is adapted for childbearing and childbirth. So there are several anatomical differences. So the main difference being the female pelvis on the right here, it is smoother and lighter, and the bone markings are less prominent. All the bone markings are less prominent here compared to the male. The pelvic outlet is larger in females, and then if you look at the angle here, this angle between the pubic the pubis here is more than 100 degrees. So it has a very wide angle. Because the pelvis is modified for childbearing, it has a enlarged pelvic outlet. And also, if you look at the curvature of the sacrum and the coccyx, it is less curved, so that it's much wider, broader, and it's a low pelvis. So these are the main differences between the male and the female pelvic pelvis. Moving on to the lower limbs. So the lower limbs are going to bear the weight of the body. So they are very strong and bulky. Like your femur is a very strong, long bone in your body, which is your thigh bone, followed by the patella that makes your kneecap, and your leg is formed by two bones, the tibia and the fibula. Your ankle is the tarsals, your feet is your metatarsals and phalanges. So those are the lower limbs that attach to the pelvic girdle. We have the thigh bone or the femur, the patella, tibia and fibula in your leg, tarsals, metatarsals, and toes. So here, the major bone markings of your femur, or the longest bone in your body, it has a head, a nice smooth head. In the head, there'll be like a little dimple called fovea capitis. So it is the head of the femur, or the proximal epiphysis where the femoral head is found. This will articulate with the acetabulum that we just saw in the coxal bone, and it attaches at the fovea capitis. Then it has a neck region, which is the narrow region. It has two trochanters. They are the bony processes. So the greater trochanter and the lesser trochanter. And they are divided by the intertrochanteric line. You can see that the shaft is found at a slight angle. So in the anterior surface, you can see the interior trochanter line and the crest in the posterior view. So they are both articulating surfaces. So here's the proximal epiphysis. It has the head, the neck, greater and lesser trochanters, the intertrochanteric lines, and the crest. And this is the shaft that is found at an angle. So distally, in the shaft, you can see a line. It's called linea aspera, which is the prominent ridge in the shaft, and it serves as the point of attachment for most of your hip muscles, and it will join with the condyles here. So distally, you can see the medial and lateral condyle, the patella surface for the articulation with the patella, and above the condyles, you can see the medial and the lateral epicondyles. In the posterior view, you can see the intercondylar fossa. So these are the main bone markings that are involved in your knee joint. So here's a picture of your patella, which is a sesamoid bone that makes your kneecap. So this is formed within the tendons of the quadriceps femoris muscle. The base of the patella will attach with the quadriceps femoris muscle, and the apex will attach to the patellar ligament. So the type of bone, it is a sesamoid bone. Coming to the tibia and the fibula of your feet, your tibia is the larger bone, and the fibula is the fine, thin, delicate bone. They are held together by intraosseous membrane. They are tough, fibrous membrane. And you can see in the knee joint, like right below it, you can see how the fibula is articulating with the tibia at the proximal or the superior tibiofibular joint and the distal tibiofibular joint or the inferior. And the other articulation would be its articulation with the bones of your ankle, your talus. So the main bone markings of your tibia, this is also going to support your body. So it's larger and it's going to be bulkier compared to the fibula. So at the proximal epiphysis region, you can see the medial and lateral tibial condyles, which is separated by the intercondylar eminence. And it will articulate with the medial and lateral condyles of the femur. The tibial tuberosity will attach with the patellar ligament here. The shaft has a line called anterior margin, which is like the sharp edge of your shin bone. You can usually see that. And distally, you can see the medial malleolus. So this is like a styloid process that we saw in your forearms. And you can also palpate this. You can see this in your ankle. This is the medial projection at your ankle. So these are the main bone markings of the tibia. So tibia is the larger bone of your feet compared to the fibula, which is the flute-like thin bone. Moving on to the fibula, the fibula is also called as the calf bone, the fibula. It attaches several of your muscles of your feet and toes. It's smaller than the tibia. There are two joints here. We have the superior or the proximal tibiofibular joint and the distal or the inferior tibialofibular joint held together by intraosseous membrane. And here you can see in the cross section, you can see the tibia, the larger one, and the fibula. They are held together by intraosseous membrane. You can also see the compact bone and the spongy bone. Oh, you can see the anterior margin of the tibia here. So this also has the head region, the shaft, and the distal region. It has the lateral malleolus here. So the malleolus are important in stabilizing the ankle bones. So moving on to our feet, there's lots of bones here. So the tarsus has 7 tarsal bones. So here's the talus. This region is called as the trochlear region of the talus. It carries the weight from the tibia to the trochlea. Your heel bone is your calcaneus. It transfers the weight from the talus to the ground. It is attached to the Achilles tendon here, the famous Achilles tendon, the Greek. Cuboid will articulate with the calcaneus. The navicular will articulate with the talus, and there are 3 cuneiform bones, lateral, intermediate, and medial. The metatarsals, they are the 5 long bones of your feet. Your big toe is number 1. 2, 3, 4, and 5, medial to lateral. Phalanges, there are 14 bones. Your big toe is called as the hallux. It has only two segments, the proximal and the distant phalanx, whereas all the other toes will have three, proximal, middle, and distal. Another very important aspect of your feet are the arches in your feet, which is very important for balance of your body. See, the arches are very important for transferring the weight from one part of the foot to another. So there are three main arches. This is because of the difference in curvature between the borders of your feet. So this arch in your feet is very vital for like a spring like action when you walk. So this is the longitudinal arch that in turn has the medial and the lateral arch, and then we have the transverse arch. So these arches are formed by the tarsal and metatarsal bones, and they are all supported by ligaments and the tendons of your feet. And I hope that was helpful.